Okay, so today what we're going to do is we're going to have a look at and talk about some infections. Usually infections will be secondary to a break in the skin. They can also cause, or can be interdigitally or between the toes. But for a case example, what we're going to use today is an infection secondary to a post-op procedure, which doesn't happen that often, but it can happen. So we take the dressing off. What the patient may have reported or started to notice is that the toe has been feeling okay post-operatively, but there's been an increase in the level of pain over the last couple of days. They may have noticed that the area of wetness around the dressing has become larger, or there has started to be some increased swelling, or there is some malodor associated with the toe at the time that the dressing changes. Okay, those are all sorts of things to look for and would raise concern if you did start to notice those things. So we take the dressing away. Sometimes a good thing to do is to if you do suspect that there is an infection, is to chart your progress or the progress of the wound by taking some photos of it and recording those and taking them in and showing the clinician them. What is quite normal to have is a little bit of redness around and through the base here immediately after the surgery for sort of 48 hours. That is what we call a bit of a phenol flare. Phenol is the chemical that we use to cauterize the matrix back in through here and stop that section from going back. However, if the redness starts to extend further up the toe, or in the worst case scenario is you actually start to get tracking, that's a real area of concern and you need to do something about that straight away. Doesn't very often happen at all, but if you start to get tracking, then you need to go to the emergency department. A little bit of redness is reasonably normal, and we've already talked about the increase in the amount of pus or exudate that comes from the wound. With these sorts of procedures post-operatively, you will get quite a bit of straw-based exudate or fluid that leaks out of the wound, and that will do that for several days afterwards, and that's quite normal because what we've done is we've cauterized and we've created a little burn down the end here on the base of the toe. So don't be too concerned about that. It's if it starts to become quite purulent, quite thick, sort of a more thickened yellowy greeny sort of colour, that is a little bit of malodor, increased pain, swelling and redness, then those are areas of concern and you need to get in touch with us ASAP. Alternatively, pop in and see the doctor, preferably to go back and see the podiatrist who's done the surgery though. Sometimes the infections will be caused by a little bit of tissue that may be sitting down and through the area, and that can be quite easily flicked out and cleaned up. The other things that you can do to help treat or manage the infections is that you can go back to doing your salt baths if you've stopped, and you can do those actually twice a day, where you'd use a heaped teaspoon of salt in a warm bowl of water, diluted, make it nice and strong, and soak your toe in those twice a day. That's quite an effective way at dampening down the infection. What the salt does is it's a natural antiseptic and it also dilutes any infective material. Also with infections, what you would tend to do is you would tend to go back to, if you've stopped, using an antibacterial, antimicrobial type of cream like the betadine or Cristoderm or one of those types of lesions and creams, and you would dress it and change it daily.